Hey, Margie here. Whether you're a cancer survivor, have a friend or family member who either has cancer or is a survivor, or you just want to learn what you can do to prevent cancer, then you are in the right place. Because today we're going to focus on cancer as well as what we can do to keep our bones strong and healthy through cancer treatment and after. And I'm very excited about our special guest today, Dr. Nalini Chilkov. And Dr. Nalini is the founder of integrativecanceranswers.com, the creator of OUTSMART CANCER System, and the author of the best-selling book, 32 Ways to Outsmart Cancer, How to Create a Body in Which Cancer Cannot Thrive. Dr. Chilkov is a leading edge authority on integrative cancer care, immune enhancement, optimal nutrition, and wellness medicine. Dr. Nalini's Outsmart Cancer programs are recognized as the most comprehensive, science-based, safe, natural programs for supporting cancer patients, cancer survivors, and those who do not want to get cancer to get well, stay well, and live well beyond cancer. For over 30 years, Dr. Nalini has helped thousands of people, many with serious and chronic illnesses, achieve and maintain extraordinary health and longevity, and is sought out by award-winning Hollywood celebrities and insiders. She has appeared as a health expert on NBC TV and has been recognized by WebMD and sharecare.com as one of the top 10 online influencers in breast cancer. And Dr. Nalini has been my go-to with so many issues on cancer for years. And I love her books. And I just am so thrilled that she's going to share such great information in this interview with you in terms of what you can do to prevent cancer and really how it affects our bones and things we can do to protect our bones and our bone marrow. So you definitely don't want to miss this. So stay tuned. Welcome, Dr. Nalini. I am so thrilled to have you here on the podcast. I love the work you do, and you've changed so many lives. And I just have to tell you, because I've had your book for many years, and I usually bring the book with me when I'm doing a podcast interview, but I realize I've given all the books that I own, which were, they were, I think, three actually, to friends and people who've had cancer because it's such a wonderful book. But thank you so much for being here.
Thank you for having me.
So before there's so many, it's so important for this community of people who care about their bone health. And there's so many people here that are cancer survivors as well and have had issues with bone health because of that. But before we start, I wanted to ask you, because you have a certain premise that you take with you in terms of all the work you do. And that's that you create a body that cancer cannot survive or thrive in. So you want to just explain that concept, because I think that's so important and it permeates a lot of your work.
Yes. So what we really want to think about, really with any serious illness, including cancer, is that we really need to understand the whole biosystem, the body that's hosting cancer. Why is our body a happy place for cancer to develop and thrive and persist? So it's like the soil in a garden. If you change the soil, then you change what grows there. So that's kind of a missing piece from oncology. And so we really need to have not only a good disease model to focus on understanding the cancer itself and what's driving it, but we need to understand the environment, the soil that it's growing in. And then if we transform that environment, which is really a signaling environment, we can change whether or not we're sending growth signals or stop signals to cancer cells. And so we really want, for the long term and the big picture, to not have a good host for cancer. So we need to create a body where cancer cannot thrive. And so that's really the premise. And there are many, many factors that go into an environment that is a place where cancer can root and grow and persist. And so we address many factors so that we actually do a more comprehensive job of looking at the patient than the oncologist does. And so by combining the best of both worlds, you really get the best outcomes and results. But then when the oncologist is done with you, you really need a long-term plan to not have a recurrence. Or if you have a lot of cancer in your family, then you need to have a good prevention plan that is really broad, has breadth and depth to it. so that you address all of the factors. And so that's really what we call our OUTSMART cancer system.
And what I love is that, sometimes people feel helpless that, oh, what can I do? Is it going to come back? And they don't realize that there's so much
Yeah,
that can
yeah,
be done in
yeah,
so many
yeah.
areas. And the other thing I sometimes look at, not that we look at cancer as a blessing in disguise, but oftentimes when then you address all of these other factors that can prevent it, your life gets better because it improves your overall health as well. Have you
Well,
seen that too?
it's a paradoxical thing, but many people say cancer is the best thing that ever happened to me because, in fact, it transforms their life. It is a great gateway in anyone's life, and it's an opportunity to reflect on your core values, what's important to you, your relationships, your work, how you spend your time. And so when you face your mortality, it really you get real. You get very, very real. And that is an opportunity to make changes. And at the same time, the oncology environment, the conventional oncology environment, is one in which the patient is disempowered and disenfranchised. And so it's very important. I always say to patients, you need a team, you need your health experts and your disease experts, but you are the head of the team. Your oncologist doesn't own your body or your schedule or your decisions. And so it's very important to take back that sense of agency and that sense of control so that you can own the trajectory of your cancer journey and what happens after your oncologist is done with you, which is a very stressful moment. You've had a lot of contact with your care providers for a long time, and then all of a sudden they say, bye, we hope you don't get a recurrence. And then you're sort of like, now what, right? So it's very important to have a plan so that that anxiety doesn't overtake you, because all cancer survivors have a fear of recurrence, and they'll always live with that. So it's important to know that you're doing things that are really going to make a difference.
That's so important because there's nothing worse than feeling disempowered. And I know, so often the very first thing that happens, and I actually teach a happiness program, is that people say, oh, poor me. And you feel like the victim. And that just unfortunately doesn't really get you anywhere. And when you're disempowered, that also happens. So working with being in charge and having this team supporting you, but then you're focusing on solutions and you have a plan, just like you said. So I love that. And I just think what you do helps people so much because when you're empowered, you can make the necessary changes to improve, really, as we said, every aspect of your life. So now I want to focus on the bones because there's such a connection. So, what are the unique concerns regarding bone health that both people who are going through cancer and survivors of cancer have that we need to really deal with?
Well, there's quite a number of things. First of all, if you just think about the age demographic of cancer patients, it's mostly people over 50. Unfortunately, because of our very toxic environment, we're seeing younger people be diagnosed with cancer. I have many more people in their 30s and 40s in my practice now than I used to.
Mm.
But really, the statistics are that as we age, because we've lived on the planet long enough and we've been exposed to multiple environmental stressors and life, that our immune system ages with us. And so we are less able to solve problems and challenges in our bodies as we age. And so most cancer diagnoses occur over the age of 50, which is also the age where women are going through menopause. And also men have bone loss as they age as well. So the bones become less dense and more porous, and so they can be more easily invaded by cancer cells. So there are a couple of cancers that readily invade the bone. Breast cancer is one of them. And so we are simply more, our bones are more vulnerable. At the same time, the things that we need to do to have healthy bones support our cardiovascular health and our endocrine hormonal health. So when you are thinking about what's going to make my bones healthier, it's a bigger impact if you get more exercise and more sleep and eat more protein and get more minerals. A lot of other things are going to improve in your health as well. So age-related bone loss is common to all of us, as is loss of muscle mass. And so a lot of these things go together with just why are we so much more vulnerable as we age? But as women go through menopause and as estrogen declines, and in men as testosterone declines, then minerals tend to leave the bone. So we need to oppose that, because human lifespan historically is most people live to about 35 years old historically in early human life. And so now we expect to live to close to 100 in the modern world if you have the privilege of access to good nutrition and medical care. And so we really have to have a plan to take care of our bones for our whole life. And so hormonal changes are a big impact. And in the modern world, a lot of medications also cause bone loss. So there's a lot of factors that cause us to lose bone mass. And you want to really be sure you're not near fracture risk. That's really the goal. Everyone over 50 is going to lose some bone mass. So we want to make sure that we have enough healthy bone that we aren't at fracture risk. So I encourage anyone over 50 to have a bone density scan, which is called a DEXA, DEXA. I'm sure you talked about it on this show since it's focused on bones. So that's not a lot of radiation. It takes about 20 minutes to have a DEXA scan. And so then you get a baseline around the age 50 of where your bones are. And then you can, every 2 years, have another scan. And then you get a sense of progression or stability in your bone mass. Some people will have bone loss earlier in life, like if you've had an eating disorder when you were younger, then you might have lost bone mass and not even know it. And so I recommend around age 50, have a bone density scan. It's good also before starting cancer treatments, because some of the cancer treatments actually inhibit bone density or decrease bone density. So if you are a breast cancer patient and you receive hormonal blockade therapy, estrogen blockade therapy, if you're a man with prostate cancer and you receive endocrine or hormonal blockade therapy, you're going to lose minerals out of your bones. So you need to monitor that so you're sure you're not near fracture risk. There's a lot of things one can do, which we're going to talk about, but you have to monitor it. It's very important. So there's the DEXA scan, but there's also a test that measures in your urine if you're excreting bone minerals into the urine, and that's called N-telopeptide. And it's really just looking at the bone breakdown products that are excreted in the urine. So if you get a snapshot from a DEXA and you have the N-telopeptide urine test, which tells you living physiology, then you have a good idea what's going on with your bones. So it's very, very important. So cancer treatments themselves can oppose healthy bone, but at the same time, cancer patients can be very fatigued and not get enough exercise because they don't feel well. So we know that weight-bearing exercise is crucial. So a lot of cancer patients will just be too sedentary. And we know that research shows that patients who do a minimum of 30 minutes a day of just moderate exercise, like a walk, actually have better survival. So it's not only good for your bones, but actually for cancer survival. And then, of course, going out and taking a walk, or, even getting on an elliptical or a treadmill will also improve your mood. And then you're more motivated to take care of yourself. And the other thing that happens to cancer patients, because their digestive tracts are affected, or they might have sores in their mouth, or they might have pain when they eat, or they may have side effects like severe diarrhea from chemotherapy. They just don't feel like eating, or they're too tired to prepare food. Then their nutritional status is also impacted. So there's a lot of reasons why the bones can be compromised when we're in the face of cancer.
I love everything you said, and it's so important. And oftentimes, I think in conventional medicine, which I don't fault them, but they're so worried about, dealing with the cancer that they're not that worried about the bones. They're just not that worried about all these other things, but everything so much can be prevented when you take an integrative approach. So I think I like what you're saying is you can work with your traditional doctor and then also an integrative. Is that what I'm hearing? That when you do the
Yes,
2
yes.
together, it can really
Well,
make such a big difference. Yeah.
oncologists are trained to treat cancer. They're not trained to support your digestive function. They're not trained to support your bone health. So it's really important that we have realistic expectations of our physicians. So you don't ask an oncologist, what vitamins should I take? That's not their training. You want to go to an expert to tell you what kind of diet and what kind of vitamins you can take with your cancer care. You want to go to someone who has a health model so that you can have a plan for your health. So I think it's, we want our doctor to be everything to us, but it's important to know who your doctor is, what they know, what they don't know. And also, on that note, it's very important your relationship with each one of your physicians. So if you have a physician that doesn't respect your values, doesn't respect your intelligence, treats you like a child, is a control freak, and won't partner with you in this journey, get out of there, because you have to have a healing relationship. You have to have a respectful relationship, because otherwise, on top of the stress of cancer and cancer treatments, then you have the stress of a toxic relationship. And so it's very important. And when someone is diagnosed with cancer, oncologists make them feel like a fire alarm just went off and it's an emergency and it's urgent care. Cancer is not urgent care. It takes a long time for cancer to develop. By the time you diagnose it, it's been in your body for a while. So if you take a little extra time and you get a second opinion or a third opinion and you find the right team for yourself, the right oncology team, then you're going to also do better psychologically. You're going to have more thoughtful care. If you have better communication and rapport with your team, you're going to be listened to more deeply. You're going to share more with them, and then you'll get better care. And so it's really important who your care providers are. And there are absolutely fabulous physicians out there. So if you are not comfortable with the way your doctor treats you or interacts with you or speaks with you, then go find somebody else, because this is going to be a long-term relationship also, and it has to be a healthy one. So if you have a health model, we have to have healthy relationships with our care providers as well.
I couldn't agree more. So I just want to circle back on something and just reiterate,
Yes.
because I think it's so important. As you know, most people do get the DEXA, and the issue is we don't know. We don't know if that's their first DEXA, let's say 50. We don't know if they're actively losing bone, what's going on. So I
That's right.
love the fact
That's right.
of getting those, the bone turnover markers, whether it's the NTX or the CTX, so they really
Yes.
can see the breakdown, and that will give you so much information. And then during the treatment, you can see, are they increasing, what's going on with even within
That's
3
right.
months. So
That's
I
right.
think that was such a good point to bring up, because that's not ordered. It's
That's right.
traditionally not ordered by physicians. And so it's something sometimes you have to ask, can we also look at whether it's the NTX or the CTX to see the
Yes. Yes.
breakdown? So
Yes.
I think that was such a good point. So let's go back to bones. So what are your basic, you said some of them, but are there any your main recommendations? You talked about the exercise. Is there anything
Well,
else for
there's a
protecting and
lot, right?
restoring
You know
healthy
that there's
bones?
a lot.
Yeah, we just give the couple ones that people can take away here. Yeah.
So, absolutely, we think about bone minerals, but most people just think about calcium. However, magnesium and phosphorus are very, very important, and boron are all minerals that are important to bone. And so we want to look for bone mineral supplements that have more than calcium in them. And we want to make sure we're taking minerals that have high absorption rates. So we want to use calcium and magnesium in their glycinate forms primarily, or their lactate forms, because those have higher absorption rates than, say, the oxide forms. So calcium and magnesium oxide are chalk. And so that's hard to absorb. Also, when you take minerals, if you have a little acidic in your stomach, it helps absorption. So you can take your minerals with water with a little vinegar in it, or with your vitamin C, something that's a little bit acidic helps mineral absorption. And as we age, we tend to have less hydrochloric acid in our stomachs. So our mineral absorption is compromised as we age as well. So some people also take a digestive enzyme with hydrochloric acid, betaine hydrochloride in it to enhance both mineral absorption and protein digestion. So that's very important. And you'll find that many bone mineral formulas have copper in them. But copper is contraindicated for cancer patients. So you want to look for a bone mineral formula that is copper free. So there aren't very many of them. My favorite formula is called OsteoBen by Designs for Health. It is a copper-free bone formula. It also has genistein in it from soy. And there's a lot of confusion about whether people with cancer should use soy. But the research has really been done to unequivocally, with certainty, state that taking genistein or soy does not drive hormone-driven cancers. In fact, it's very protective. And in bone tissue, as other tissue, there are different kinds of estrogen receptors to which hormones will bind, and then that causes a signal inside of the cell. And there are two different kinds of estrogen receptors, and the bone estrogen receptor does not drive cancer. And so that's why soy is safe. So it's very important to understand that. People are very confused about soy and its safety in estrogenic cancers. It's very important to understand there's two different types of estrogen receptors, and the bone has the type that doesn't drive cancer. The estrogen receptor in the breast tissue, in the uterine tissue, in the cervical tissue, places where we see estrogen-driven cancers. That's the second type of estrogen receptor. So it's actually quite safe to use soy to promote good bone health because it contains a plant estrogen, a phytoestrogen called genistein. So this OsteoBen formula has genistein in it, which is really great for bones, really fabulous for bones. So we want to have bone minerals. We want to have a little bit of genistein, ideally, and we want to avoid copper. Why do we want to avoid copper? Because cancer cells utilize copper for growth and for proliferation and for spread, for metastasis. And so if we lower our copper intake, then we will not be supplying cancer cells with copper for additional growth and proliferation. So the cancer patient or cancer survivor needs to also make sure their multi doesn't have copper in it as well. So you're going to look for a copper-free multivitamin and a copper-free bone formula as well. And that's very important. Of course, vitamin D is extremely important to bone health. The only way to know whether or not you're getting enough vitamin D for you is to measure vitamin D in the blood. So we measure 25-OH vitamin D in the blood. And my goal for cancer patients and cancer survivors is to have a blood level around 70 or 80. Now, the normal range for vitamin D in the blood is between 30 and 100, which is a big range. So the question is, where is a healthy vitamin D level? And then in this context, where is a healthy vitamin D level for a cancer patient or a cancer survivor? Because that's an individualized decision-making about what is our goal for health for a cancer patient or cancer survivor for bone health. So around 70 or 80, you really can't achieve that unless you supplement vitamin D, and you want to make sure you're taking vitamin D3, very important. So a lot of oncologists actually now prescribe vitamin D to their patients, but they prescribe vitamin D2 usually. So and they usually prescribe 50,000 units once a week, and that's hard on your kidneys. So I prefer to give, most of my patients take 5,000 to 10,000 units of vitamin D a day, vitamin D3, and then you want to put vitamin K with that. So you want to look for a vitamin D supplement that has vitamin D3 plus vitamin K, because vitamin K is very important to bone health as well, because it helps to direct the calcium to go into the bone. And so when you're going to take a high dose of vitamin D, 5 or 10,000 units a day, you want to combine that with vitamin K so that the body knows where to put the calcium. And the great thing about optimizing vitamin D for cancer patients is that vitamin D has a dramatic effect on immunity and on cancer immunity. So that's the other benefit of optimizing your blood levels of vitamin D for cancer patients. In addition, vitamin D has a big impact on mood. And so optimized vitamin D is good for depression as well. So we get a lot of benefits besides bone health by optimizing vitamin D. A lot of people don't realize how important magnesium is, and women have a much higher need for magnesium. So we can't just focus on calcium. We have to make sure we get adequate magnesium. And I like women to get a 1-to-1 ratio of calcium to magnesium. And most supplements are a 2-to-1 ratio, twice as much calcium as magnesium. So you want to make sure that you're getting an equal amount of magnesium and calcium. Now, there's a lot of controversy about how much calcium should you take, how much calcium is safe. I recommend to my patients about 500 milligrams of calcium a day is sufficient. You will find that in conventional medicine, physicians are prescribing 1,000 or 2,000 milligrams of calcium a day. And that is because the standard American diet causes you to pee out all your calcium. So if you're on a plant-strong diet and you're not eating refined sugar, drinking coffee and carbonated beverages, and eating excess amounts of animal protein, all of that makes you pee out your calcium. And so if you're on a plant-strong diet, that's not happening. So you don't need those huge amounts of supplemental calcium. So it's very important to have some kind of good counseling from a nutritional expert. And then, of course, we're going to monitor calcium in the blood. We're going to monitor the breakdown products of calcium in the urine, and then we'll find where your balance is. Mentioned as we age, our absorption of calcium is less. So sometimes you have to take a little bit more to get that blood level. So it's calcium metabolism is not straightforward and simple. So it's important to have a bone mineral supplement that has adequate calcium in an absorbable form, like a glycinate or a lactate or a malate form. And to make sure your calcium magnesium ratio is 1-to-1, a little boron in there and a little bit of genistein in there, and to make sure that it's copper free, and to make sure that you take it with something acidic in your stomach. Also, bone minerals, where bone minerals are is dependent on our hormonal status. So it's very important to be monitoring all the hormones that impact bone metabolism. So it's not only estrogen, right? Estrogen, testosterone, DHEA, thyroid hormone, and also our stress hormones all impact whether or not the calcium gets to the bone or is outside the bone. So you want to be monitoring your hormones as well. And you want to be under the care of a provider that understands how to properly monitor hormones, accurately monitor hormones. And of course, as we age and go through menopause, and in man andropause, our hormone levels change, and then our bone density changes because of that. Now, in United States, we have mostly sedentary lifestyle, and so most people are sitting too many hours of the day, and bones need stress on them. They need the stress of gravity. They need the stress of the muscles pulling on the bone. They need weight bearing in order for the minerals to stay in the bone. So you actually need to exercise in order to maintain bone health. What's very interesting to me is that really osteoporosis is a modern disease of privileged people. In countries where women have 13 children and give all their bone minerals away to their kids when they have a pregnancy and nurse them, and they have poorer nutrition than we have, osteoporosis is unheard of in those cultures. Why is that? Because they're carrying their babies on their back all day long. They're out and walking, or they're carrying water on their head, and they have weight bearing, and they're active most of the day. So, if you're sitting around thinking great thoughts all day long, you're not getting any gravity or muscle pulling on your bones. And so I have seen there's these great like leotards and workout clothes that have weights in them to increase the stress on the bones. And also you can wear a weight vest if you go out walking and increase the weight on your bones as well. It also increases your cardiovascular fitness. So those are really important things, but also protein. Uh, the collagen matrix in the bone is a protein, and you can't just focus on minerals. You have to get adequate protein. And in fact, our need for protein increases as we age. And a lot of people tend to eat less protein as they age. So there's also been a myth that too much protein causes cancer. And that's actually been refuted. That is absolutely not true. And so if you really want to have healthy bones, you need, as a over 50 adult, you need to be thinking about somewhere 70, 80 grams of protein a day, which is a lot of protein. A lot of women just don't eat that much food. So then you need to think about, how am I going to get that protein? So a simple way to do that is to like take a scoop of protein powder and just put it in a glass of water and get a 20-gram serving of protein. Bone broth, real bone broth, has 10 grams of protein per cup. So you could have 2 cups of bone broth every day instead of 2 cups of tea, and get another 20 grams of protein that way. So you have to think about what you can fit into your lifestyle. Some people chew on these like, healthy beef jerky or salmon jerky or venison jerky, dried animal protein, but it tends to be expensive and too salty also. So, and hard to digest, pretty hard to digest that. But, you have to think about, what are you going to do when you travel? So I always think about just having a little Ziploc bag of protein powder with me, and I'll put like a heaping tablespoon into a glass of water in the afternoon and get another 20 grams of protein. So you have to understand, where does protein come from? And if you're eating a plant-strong diet and eating healthy, clean protein, you can think about wild-caught fish and grass-fed animal products, free-range eggs. Those are all healthy if you have clean proteins, right? And then, of course, protein comes from beans and legumes in the vegetarian world. But it's really hard to get enough protein as a vegetarian. So I'll put a protein shake, or suggest you use protein powder just in a glass of water, into my patients' plans. A lot of cancer patients just don't feel like eating, or the digestive system is compromised, or they're nauseous, or they have mouth sores, having diarrhea. So having a protein shake can be a solution, a meal replacement. If you also put healthy fats and some fiber into it, then it can be like a meal replacement, where you get your calories and enough protein as well. The other thing that really damages bones is inflammation. So we want to be sure that we have a plan to eat an anti-inflammatory diet. So that's a plant-strong diet with lots of healthy fats and oils in it. And so we think about really plant oils, olive oil, for example, nut butters, healthy nuts that aren't rancid, oils that aren't rancid. So you have to store your oils in the refrigerator and then just take out a little bit to use on your countertop, so that your oils don't go rancid. Avocados, things like that, can be added to a shake and just added to your diet. And so we want to think about managing inflammation as a way to have healthy bones as well. So poor nutrition is an issue. I mean, you aren't going to have healthy bones or healthy muscles or a healthy immune system if you don't have good nutrition. And one of the risk factors for cancer patients is loss of muscle mass. So if we don't have muscles pulling on the bone, then we're also going to have less bone mass. And in advanced disease, there is a physiology where both the bones and the muscles start to really dissolve. And so we don't want to get there. And so by implementing all of these factors, making sure your protein intake is good, your mineral intake is good, your inflammation is managed, you're getting weight-bearing exercise. So all of those things. But then stress also impacts bone health, because stress hormones and also the medications that mimic stress hormones, like steroid drugs, like prednisone and its analogs, will actually dissolve the bones. Too much thyroid activity metabolically or excess thyroid hormone medications will dissolve the bones. So there's a lot of factors that impact bone physiology beyond just minerals. And sleep also is a big factor, because if we don't get enough sleep, then our stress hormones increase, and then we're dissolving our bones. And so there's a lot of factors. And so you really want to be under the care of someone who can really do a good evaluation and look at your whole system. And that's what we do in the OUTSMART Cancer System. Anyway, it's a health model, and we always have to include bone health, because it's crucial to having a healthy, long life. And so these are the factors that compromise bone, and some of the things that you need to think about in order to have healthy bone.
Wow, Dr. Nalini, that was such an incredible answer with so many pieces to it. I had 2 quick questions though. One was, certain people find out they're zinc deficient, and then when they have zinc, they say it offsets the normal zinc copper balance in the body. But you're saying no matter what, do you have to limit your zinc as well? Is there any, you're
No,
saying.
no, actually, zinc is really important to cancer immunity. So remember that zinc and copper are micro minerals in the body. And so it's if you measure zinc in the blood, hardly anybody has excess zinc in their blood. And so when we say restrict copper, we mean let's restrict copper in supplements, because all vegetables have copper in them and all animal protein has copper in it. So we're not going to be on a zero copper diet ever, because copper is crucial to normal physiology. We just don't want excess copper. So I do measure both copper levels and zinc levels in the blood of my patients. And what my goal is to actually have a ratio of zinc to copper 1:1. And even actually a zinc to copper ratio of 2:1 is more cancer protective, because zinc opposes copper. And so that helps us control copper availability to a cancer cell. Zinc is also incredibly important to immunity. Incredible. We learned that in the whole COVID uh,
Yeah.
uh, adventure. So I do not restrict zinc. In fact, I usually prescribe zinc to my patients. Zinc in the diet comes from seeds, usually. It comes from pumpkin seeds, sunflower seeds, things like that. Oysters also. But zinc, nobody's ever excess zinc unless they're taking a mountain of supplements. I've never seen an excess zinc.
Okay, because so many of the zinc supplements will also have copper. So I guess your
Yes,
suggestion is,
exactly.
yeah, is to just find
Exactly.
one without copper and not
Yes,
worry
zinc and
about,
copper
yeah.
are often together in mineral supplements. So there's zinc you can get. Prefer zinc picolinate is the more absorbable form of zinc. But if you combine zinc with molybdenum, small amount of molybdenum, you get this incredible control over cancer. And so
Oh,
I use a zinc supplement with molybdenum. There's one called Zinc Supreme by Designs for Health. It's 30 milligrams. I usually prescribe 60 to 90 milligrams a day, depending on the blood levels of zinc. So I actually promote zinc. I don't inhibit it.
okay, great. So there's so much more to talk about, but I also want you to just mention the bone marrow, because
Yes.
oftentimes with cancer and cancer treatment, that can be affected. And
Yes.
why is that so important? Something we also have to be
Yeah.
aware of.
The bone marrow is the factory where all your blood cells and all your immune cells are made. And so having healthy bone marrow is incredibly important. As we age, the bone marrow ages as well and becomes less efficient. There's an anemia of old age that can set in. So if you have a cancer patient who's in her 80s, then you want to be concerned about her bone marrow just because of her age as well. So the bone marrow is found in the long bones of the body primarily, and it's very rich environment of different kinds of cells, and there's some fat in there as well. And it is a very physiologically active tissue. In cancer treatment, the goal of cancer treatments is to stop cell division in rapidly dividing cells. So we're targeting the cancer cells, but there are other rapidly dividing cells in our body. And so when you have treatments like chemotherapy, which are targeting cell division, where are we going to see the side effects of chemotherapy? In the other tissues where there's high rates of cell turnover. So that's your skin, that's the lining of your mouth, the lining of your digestive tract. Those are some of the places, your hair follicles. That's where we see cancer side effects. And so the bone marrow can be really compromised by chemotherapy. And so most cancer patients will have low cell counts of their red blood cells, white blood cells, immune cells, and platelets because the chemo has not only affected the cancer cell, but it's affected the fast dividing cells, including the bone marrow. There are certain cancers that are diseases of the bone marrow as well. And so, for example, certain types of leukemias are where the white blood cells will overtake the red blood cells and other cells and crowd out all the other healthy cells in the bone marrow. And so you have too many white blood cells and not enough of the other cells. So you have dysfunction of having enough immune cells and red blood cells when you have a cancer like that. So some of those patients will receive therapies where their bone marrow is actually ablated or completely damaged and then replaced. And so that's an extreme therapy, and really is a small percentage of cancer patients. Most cancer patients are just having bone marrow compromise because of the toxicity of chemotherapy. So it's important then to support the health of the bone marrow. And that is really pretty straightforward and simple to do. One of the most powerful things is acupuncture, actually. And there are two very strong acupuncture points, stomach 36 and large intestine 4. And if you needle those points or apply heat to those points, the bone marrow is stimulated. So I actually teach my patients how to apply heat using the end of an incense stick. And you just hold the incense stick above the point and warm it up. And that stimulates the bone marrow. And so I just teach my patients how to do that at home. Then you're doing a therapy that's not interfering with drugs also. So you can do that. There's also in modern China, then cancer clinics in modern China, there is a formula that is given to chemotherapy patients to restore the bone marrow. And there is a company that makes that formula that I prescribe. It's called Marrow Plus, and it's made by a company called Health Concerns. And you take 3 capsules 3 times a day while you're undergoing chemotherapy, and for a couple months after you complete your treatment until the bone marrow and the cell counts come back to normal. Those are the main things. If your white cells go very, very, very low, you can also use a Chinese herb called astragalus, astragalus. Astragalus is also one of the most widely used immune drugs in cancer care. And so we use that not only for cancer immunity, but to restore the bone marrow's ability to produce white blood cells and immune cells. About 3 grams a day, 3,000 milligrams a day of astragalus. The only contraindication to taking astragalus is if you have autoimmune disease, if you have leukemia, or if you're on immunotherapy, then you would not use astragalus. But otherwise, it's quite safe. And in China, they also have this tradition of making medicinal soups. And so they'll put astragalus into the soup as well. And you can also nourish the bone marrow with another Chinese herb called dong quai, Angelica sinensis. And that is really lovely also to put into a soup. It's a blood building herb, more for the red blood cells. And melatonin is very good for platelets. Some cancer patients get very, very low platelets, which are the cells that are important for normal blood clotting. So if you have low platelets, you might bruise easily, for example. So melatonin at a dose of about 20 milligrams a day at bedtime is very good support for the platelets. And melatonin also has a very strong impact on cancer. So you get some cancer protection at higher doses of melatonin as well. So it's very important. If you see, I always monitor all the cell counts, as do oncologists. And it's very important to restore normal, healthy function to the bone marrow in the face of cancer treatments.
Wow, Dr. Nalini, I love all these things that you've learned and
There's
that
a
you
lot to
add.
do, right?
Oh my gosh, this is so wonderful. So tell everybody how they can learn more. Tell them actually about your Outsmart Cancer programs because they're
Yes,
so
yeah,
fabulous. Your book's incredible. And just like today, where you give practical information that people can do, these things are doable
yeah.
and they can make such a big difference. So why don't you share about your programs and how people can
Okay.
access them?
Well, we have a bonus offer for your listeners, which summarizes everything I talked about today about bone health. And we've attached to that all of the supplements I recommend for every stage of the cancer journey. And that's available at the link integrative cancer answers slash integrativecaranswers.com/healthybones23. And so you'll put that link up, I'm sure. And
Yes.
so that will summarize everything that I've just talked about. In addition to, patients always ask, what supplements can I take? And so I think of the need for different supplements at different stages of the cancer journey. So we've included all that information for you with the bone information as well. And that will take you to my website, integrativecaranswers.com, where there's a lot of free information and about 200 recipes and about 400 blog posts with all kinds of information. And then you also mentioned my book at the beginning, 32 Ways to Outsmart Cancer, How to Create a Body Where Cancer Cannot Thrive. And that is really a good start to start changing your lifestyle and understanding what the big levers are to really, really transform your biosystem so that it is resistant to cancer rather than a happy home for cancer.
Oh, I love it. And what I really like is that it's not overwhelming. You know, the steps you can do, and you don't have to do all of them, but
Right.
they're easy to implement and you're very clear how to do it. And it's just wonderful. I've been a big fan of yours. I guess since 2011, when I actually went back into health coaching after only
Yeah,
being a physical therapist. But
yeah,
I
yeah.
just you've helped so many people and everyone who has had cancer and both all aspects of it, prevention as well as that there's just so much more than just killing the cancer. There's so much more, as you said, that it turns into a blessing in disguise. And I love that philosophy. Is there anything else before we end? We could talk forever. And I'm so grateful for everything you shared. And I know it's going to help so many of us. So is there anything else before we end that you want to say?
Well, what I really like people to remember is that you can have a big impact on your cancer journey, a big impact. And you can do a lot of things that don't cost any money at all. And then you can decide you want to invest in supplements and other types of care. But everyone is capable of transforming their outcome. And so it's really important to understand that. You have to really take the reins and build your health and build a cancer resistant body. And then you can really also have more peace of mind, which I think is really crucial as well.
Oh, well, we'll have all your links, but thank you so much. This has just been so informative. And again, I just appreciate all the work you're doing in the world and all the people's lives you've changed. So thank you for being here. I hope you enjoyed my interview with Dr. Nalini as much as I did, and now have some more information on things you can do to both prevent cancer and if you're a cancer survivor, things you can do to help protect your bones, stay healthy, as well as keeping yourself healthy and thriving as you age. All the links that Dr. Nalini talked about are in the show notes, and I highly recommend taking advantage of them because there's so much fabulous information both on her site, in her book, and in the special resource that she has for all of us. And you can also download my free handout and course on improve your bone health naturally. So thank you so much for tuning in, and I look forward to seeing you on the next episode.